Go.
Today I'm going to be performing a sterile field. The first thing what I'm going to do is I'm going to check my client history, check the records, know who I'm dealing with. The second thing is I'm going to gather all my supplies, and upon doing so, I'm going to be checking for the expiration date, make sure the quality of them is good, making sure that they are dry and intact. And then I'm going to go and I'm going to approach my patient. I'm going to knock on the door, gain entry. And upon entry, I'm going to identify myself as a student nurse and perform hand hygiene. And then I'm going to ID my patient with two forms of identification, whether it's his name and his date of birth. And then after I get that, I'm going to explain to him what I'm going to be doing today, which is a sterile field. And then I'm going to go about my sterile field. I'm going to take my packet, my sterile drape, once again, looking for the expiration date and make sure it's not open. I'm going to open up away from myself and dump it out. And then going to, this is the blue side, only touching the 1 inch outer perimeter. And then going to unfold it. Without reaching across, I'm going to straighten it. Okay, and then I'm going to gather my equipment, my gauze, opening it away from myself, dump it on my sterile field. My next gauze, my 4x4, once again the expiration date and seeing if it's dry. I'll be on the sterile field. And then I have these cotton swab. Once again, opening it away from me, and then dropping it onto my sterile field. That concludes my sterile field. I am then going to do my sterile glove technique. Not turning my back on my sterile field, I'm going to take my gloves, making sure they're the appropriate size, and have a backup just in case something were to go wrong. Checking for expiration date and see if they're secure and intact and dry. Open up away from me, put that on the counter. I'm going to open up my gloves with the cuff facing towards me. I'm going to do the outer one, the one closest to me. And then using my fingertips only, I'm going to go underneath and open up my gloves. Use my non-dominant hand. I'm going to reach for the cuff of the dominant hand, not crossing over. Putting it above, going to slide on my glove, only touching the inside of the cuff. And then going to take my 2 fingers, put it right inside the cuff like so, and then insert my hand, only touching the sterile outside. Making sure that is secure all the way around. Then I'm going to do the other one. And then I'm going to pray, and I'm then going to do my aseptic technique on my patient, and then thereafter I'm going to remove my gloves, pinching the inner. I'm going to take the one off, crumple it up. Then on the other one, I'm going to go underneath, folding the other glove inside the glove, dispose of the gloves, and perform hand hygiene. And that concludes my sterile field technique. Thank you.